the YMCA began to work with Groundwork Elizabeth, Trinitas Regional Medical Center, the EDC, and the City of Elizabeth. We began to focus on community gardens, nutritional education, worksite wellness, and a walkability audit that was spearheaded by the Alan Voorhees Transportation Center at Rutgers. And I am a proud alumni of Rutgers. Any of you that are in the room at Rutgers, it's a beautiful thing. And we also participated in a National Walking Day. If you look up there, I even did that, and it was raining on that day. I'm going to tell you what my hair looked like and the makeup and all the rest of that, but I was out there walking. So, at the end of the day, we knew that this was an important thing for our YMCA to be doing. We want to give a special thanks to Groundwork Elizabeth, and I think Jonathan is somewhere, who's part of Together North Jersey. And everyone is working towards healthier alternatives to transportation, including walking, cycling. I had one of my staff people cycle here today, and it's 90 degrees outside. Where's Paul Mikowitz? He's sweating outside? Well, I saw him last, he was sweating. But we did this including walking, cycling, and integrating healthy eating into lifestyle. Everyone today is going to enjoy a healthy lunch that's being provided by Together North Jersey and spearheaded through Jonathan, so we appreciate that. So our journey continued. In 2014, our YMCA was awarded a CDC Community Transformation Grant to expand our work with diabetes prevention and healthy eating and physical activity standards for all preschool and school-age child care programs. We received a grant from Elizabethtown Healthcare Foundation that allowed us to continue to expand the work we started in 2013. And we also received a second grant from Shaping New Jersey's Department of Health to focus on sustainability for our team, which is why we are here today. So if everybody can just give the folks from the Department of Health a great round of applause, and the other foundations that have helped us. So our journey continued. And so at that point, my good friend Karen Ensley said Rutgers Cooperative Extension should be part of this. So they became part of it. Elizabethport Presbyterian Child Care Center became part of it, along with Elizabeth Neighborhood Health Center, the United Way of Greater Union County, and the Elizabeth Board of Education, and my good friend Julian Dundas in the back, joined our Shaping Elizabeth Community Team efforts. So behind me on the screen, or actually on the side of me on the screen, you'll see the organizational chart for the Shaping Elizabeth efforts. Again, it's also in your packet. And I want you today to make special note of the 4 work groups that are listed on the organizational chart, and the same groups that you see listed around the room on the easels. Access to healthy food, ability for active living, school wellness, and community health. So when you look at the org chart, it's those 4 boxes that are over to your left. Thank you. Such a good IT staff, I love that. Those 4 boxes are the reason why we're here today, and as the day goes on, I'll get into explaining more about what that absolutely means. Now I'd like the Shaping Elizabeth team to stand and be recognized. I tell you, these people are the people that day in and day out are working together countlessly in an intentional way to really try to promote health and wellness in the city of Elizabeth. These people are the superstars, is kind of what I call them, the people that wave the flag to make sure that we're doing the best we can in the city of Elizabeth to be sure that we're as healthy as possible. So you can see their names on the screen. Abby Nagel. Is Abby here from Trinitas Health Foundation? Abby, stand up. I want you all to stand up. I want you to stay standing. It's important that you stay standing. Elaine McCahey, my superstar from the Gateway Family YMCA. She carries the flag for healthy living at our YMCA, and proud to have her on our staff. Bill Butler, who's our Associate Executive Director at the Gateway Family Y here at the Elizabeth Branch. Is Bill in the room?
He's still outside.
He's still standing. So you all that I called, stay standing. Catherine Hart, who is with the Elizabeth Housing Authority. I don't know if I saw Kathy here today. Kathy and I go way back. She went to Benedictine Academy, and I went to Mother Seton and Clark. And we both played basketball together. I'm happy to say that we always won. But I tell you what, you know Kathy's height, you see see mine, imagine us underneath the basket. Interesting stuff. Debbie Ann Anderson from the United Way of Greater Union County. I don't know if I saw Debbie. She's on when? Oh, you're on. Well, you're better looking than Debbie. Stand up, stay up. Eileen Kelly from the City of Elizabeth. Jonathan Phillips from Groundworks, Elizabeth. Jose Rodriguez from the Elizabeth Board of Education. Karen Ensley from Rutgers Cooperative Extension. Carla Spivey Bowie from the Elizabethport Presbyterian Child Care Center. Kathy McCarthy from Trinitas Regional Medical Center. Krishna Garlick from the City of Elizabeth. Melinda Molesky, my right hand, my Chief Operating Officer from the Gateway Family YMCA. Michael Johnson, who is one of our other superstars in terms of promoting health and wellness in the City of Elizabeth and also across our association. And he does a pretty good job making sure I eat well every day. So, Michael, you know we love you for that. Michelle Ali from Trinitas Regional Medical Center. Stu Bressler, our money man from the EDC. Toby Russell from the Elizabeth Neighborhood Health Center. Give these folks a round of applause.
Do a better job than Darren, that's for sure. I was listening to you through the windows. Very, very good presentation. I thank you for that. And the members of the Board of Education, Freeholder Sergio Granados, Freeholder Bruce Bergen, who just stepped out, and to all the providers that are here as well, and our Director of Health and Human Services, Krishna Garlick. You know, in the City of Elizabeth, we do a few things, but we don't do enough. I mean, we talk about walking, we talk about bike paths. I personally, every morning, walk 4.2 miles, and people look at me and say, "Are you crazy, man? What do you do that for?" I got nothing else to do except that's the real reason I do it. But it really makes you feel a little bit better. I mean, how do you get that discipline in order to encourage other people to do it as well? We started a bicycle path in the City of Elizabeth, and we completed the first phase along the river. It's called the River Trail. And the second phase, the money's in place to go. But guess what? We ran into 300-year-old artifacts and pottery in Pearl Oval Field across from Elizabeth High School, or whatever they call it. They broke it up with so many schools these days, I don't know what they call it. But 350 pieces were thousands of little pieces of historical artifacts. So the Historical Trust Commission let us build the second phase of the bike path until we decide how we're going to, I know who the hell puts these little pieces together, but obviously it's important to somebody, and it's delaying our second phase of the bike, the river trail. And then the third phase would take us all the way to Montana Park. And then the next phase we're going to build behind the library. And I'm hopeful that all of this gets going in the next year or two. But I think bicycle paths are important. I think walking is important. We did walks, and the director sponsored walks outside of City Hall where we got city employees together on their lunch hour. But all of us working together, and all of the providers, I thank the Y for this grant in order to pull all of you together to make the City of Elizabeth and our surrounding regions healthier through this cooperative effort. I thank you for having me, and we pledge our support in any way that we can help make the goals of this a reality. Thank you for having me.
Thank you very much for your support and the good work you guys do in this community. So, and I want you to stay here, Mayor. I need for a picture because I know you will run out.
What's in here?
You can't tell yet. They get it later, but I'm going to keep them here. So.
About the University of Delaware. Too many Rutgers graduates in the room. Do you have any Delaware, University of Delaware? We do have one in here with this show. All right. They used to call us blue heads, but in all actuality, we call ass kicking chickens. So, that's what they said when I was being recruited. I had no idea what a blue head was coming from Texas. And then I asked one of the coaches, and he says, "Well, you got to look it up in the encyclopedia." Then I asked the other coach, he looked me right in the face and said, "You know what? We're nothing more than ass kicking chickens." So, thanks for the invitation for today, and Crystal and Melinda and Elena. I keep saying Elena, but it's actually Elaine, so my apologies.
All right, we got it.
It's been so
All
much
right.
time we've been on the phone over the last couple of months, and she's been telling me all the wonderful things about, not only about the City of Elizabeth, but also about this working group. So my job here today is to kind of invigorate you and to fire you up and to share some data and some information with you today. Now, most of the information I do have, I don't have a lot of specific data on the city of Elizabeth other than what's been shared through the Berkvis and other data sets. However, what I'm going to try to do to a certain degree is to illustrate or to demonstrate or to use as analogous other communities and the work that we've been doing quickly across the state. Now, I just got to get a couple formal things out of the way. I am with the New Jersey YMCA State Alliance, where we serve all 39 corporate YMCAs across the state. We also are the largest provider of child care, and also we have some major initiatives that's taking place across the state. And one of them you're going to learn about today is the New Jersey Partnership for Healthy Kids, where we're mobilizing local and state partners to prevent childhood obesity in 5 major cities. But I'm here to tell you today we've expanded that to over 40 communities with the help of my partners. I see Janet here in the room. Janet, you standing? Yes, you are. All right, Janet. I'm sorry, Janet. I didn't mean it that way.
Just wait.
And I just saw Kathleen Morgan. Kathleen, how are you doing, guys? So Kathleen, these are some of our statewide partners that's helping us to galvanize and to get this work off the ground. And I'll be the first person to tell you, this work is not easy, especially when Bill and myself are in the room with about 11 to 12 ladies. We get very little to say, but what I do say is very profound in that right now in the 2 minutes that you guys allow me. We also have the Healthy You. We have the 7th grade membership initiative. We have the YMCA Diabetes Prevention Program, Live Strong Part, Primary Healthy Communities, and also Partners in Prevention, which is a child sex abuse prevention program. So we're doing wonderful work across the state. And quickly, I just mentioned what the New Jersey Partnership for Healthy Kids is. Currently, we're a 6-year campaign funded by the Robert Wood Johnson Foundation to implement environment and policy changing strategies across the state. We started this voyage in 2009. At the particular moment, we are funded until 2015, but I think the work is going to continue in the eyes of the Robert Wood Johnson Foundation. It may just be slightly different, but we're continuously focusing on environment and policy change, and some of you may be looking at me like, what does that mean? I'm going to get a chance to share that with you. Now, we are in 5 major cities, where Janet likes to call our demonstration projects. We are in Newark, New Brunswick, Trenton, Camden, and Vining. So if I mention these communities, it's not that because these communities are my favorite. Right now, the city of Elizabeth is my favorite. I'm here current. And it's very difficult for me to slide out of this room with 40 people barricading the area so I can't get out. I can take 4 of you. 4 or 5, but the other 45 I'm going to have a rough time with. And we've done some magnificent work there, and some of our learnings that I'm going to share with you is because of the things that we've done in these other 5 cities. One thing I want to emphasize is that my coach was here, he probably said that's typical, he dropped the ball. We have strategies that was community originated, strategies that was tailored and implemented by the community. So we actually went out into the community, we had forums, we galvanized the residents, we asked them. See, that's something that's very important about this work, because many times us have all these credentials behind our name, we want to come into communities and we think that we know it all, but the person that knows it all is grandma who's been living in that community for 75 years, who done raised 12 kids, probably raised your kids down the street as well, because back when I was growing up, if I was acting up down the street, everyone on the street knew it. I already been punished 4 times. By the time I got back home, my mother said, "There's nothing for me to do. Now go back out there and act like you have good sense." So when you're dealing with individuals like that, those are the people that hold the information. Those are the individuals that we need to go to before we begin implementing this type of work. You guys are getting me fired up already. Let me slow down here. All right, a couple things about this presentation that I would like to share, or at least you'll be able to take from it. Number 1, why does where we work, live, and play and raise a family matter? Number 2, to understand environmental policy change strategies. Number 3, to advocate for public policy. I am so glad we got our 3 holders here today with us. I know we said the mayor will be here, we have other dignitaries, because it's important for us to partner with our dignitaries. And the reason being is because they are managing so much. We don't realize how much they manage, and they're looking for us to be the experts. Sometimes when we go to them with information, they had no idea, and then they act on it. So let's always remember that we're in this together. We're not finger pointing about who's doing what, who's not doing enough. And frankly, we're all not doing enough. when it comes to health matters in certain communities. So let's make sure that we collaborate and work together, and I'm glad our dignitaries are here today. If we missed any others, welcome. Also, to collaborate with community, civic leaders, and policymakers. Look at that, that was a great time, great segue. And lastly, to assess and build healthy communities through a lens of equity. So quickly, social impact zip code. So a couple days ago, I was reading through this unique, I think it's a project, but it's a white paper that's by the Urban Institute program on neighborhoods, youth development, understanding how place matters for kids. I know this slide is a little busy, but I just want to take time to read these 2 paragraphs. It says the central goal of U.S. social welfare policy is to ensure that all children have the opportunity to reach their full potential as productive adults. Yet it is increasingly clear that where children live plays a central role in determining their life chances. Children growing up in high-poverty neighborhoods with extreme levels of racial and economic segregation and inadequate public services, police, schools, sanitation, grocery stores, are at risk for a range of negative outcomes, including poor physical and mental health, cognitive delays, risky sexual behavior, and delinquency. So if you get a chance to read this white paper, all you need to do is Google the Urban Institute's program on neighborhoods and youth development. It's a fascinating read because it brought some insight into me. And I say that is because when I was growing up, and I grew up in much better than my parents. My mother said she didn't realize she was poor until she was about 13 or 14 years of age. And sometimes that's a good thing because you don't realize what you don't have, so you make do with what you do have. But our job as a New Jersey Partnership with Healthy Kids is really to bring to life amenities and necessities that you should have in your community that you don't. What I mean, if you're living in a community, I can walk 3 miles and ride my bike 3 or 4 miles down the road, and there are certain amenities that they have that I don't have, then we need to start to advocate for ourselves. And if you don't get anything out of this presentation I'm going to share with you today, we got to learn how to begin to advocate for issues that are not our own. I think I said something. Let me slow that one down again. I think we need to begin to advocate for issues that are not our own. I have my buddy Charles Brown here with me. The reason why I love Charles Brown, not only is he from Mississippi, he can interpret for me. But also, what he's been doing is going throughout the state and ensuring that we have complete streets. The ability to bike, the ability to walk, where we have crosswalks. We have certain communities where pedestrian safety is definitely at risk. We have children that are walking in front of school buses and walking down streets that they have no business walking down without having complete streets, putting them in jeopardy. But yet we've engineered physical activity out of our children's lives. There was one point in time, remember when the parents was growing up, they would walk 3 miles to school and back. Literally, they would walk. Now we have schools that are planning and it's only 5 minutes away, but because of crime and because of the environment in which the community is in, parents don't feel safe to allow them to go out. So what should we do about that? So we know, if we talk about childhood obesity, and mostly my terminology is going to begin to change. Like I mentioned, we're moving into a transition period where we're going to talk about helping children to achieve a healthy weight. Because we're using this word obesity, and many times we misconstrue what obesity means. We begin to point fingers. We start to kind of place blame on the families, on the individual, and let me tell you, the communities in which we live in. You can't necessarily place blame because we've engineered everything out of their lives. We'll talk about that. So we talk about childhood obesity. We talk about the health and quality of life, medical costs, national security, education, economic competitiveness. So quickly, this was a census tract that was from 2006 to 2008. I don't have any updated data, but I just want to take this opportunity to share with you. These were children that were predicted to be above average risk for obesity, ages 6 to 17. As we can see, Cumberland County, when we talk about the county health rankings, tend to be 20 and 21. We'll talk about that a little later on. But here's a cluster. And right here, one of the reasons why the city of Newark was chosen as one of our demonstration projects is because they had obesity rates, 1 out of 2 children considered to be overweight. Now we can see here that Union County, am I right? I get Essex County and Union County. Kathleen, you got to help me out. I get Essex County and Union County mixed up sometimes. So just don't hold it against me. But we can see here that there's above average risk for children to be overweight. This is data that we had years ago, and this actually came from the Urban Project as well, the Urban Institute Project. So, as we're moving forward, we talk about the county health rankings. Is anyone familiar with that? So the Robert Wood Johnson Foundation, they collaborate with the University of Wisconsin, the Population Health Institute, and what they do is they rank the different counties throughout the state. Now, this is not in essence, a report card or something for us to brag and say, by the way, we're ranked number 1 and number 2. This is a conversation piece. So what the foundation does is they take a look at health outcomes, the length of life, and the quality of life, and then they rank the counties. Unfortunately, 5 out of the bottom 8 are in South Jersey. So that's a different conversation when I go down to South Jersey. But we can see here that Union County is ranked number 10. So you're kind of right there in the middle. Is that a good thing or a bad thing? We'll leave that up for our conversation later on. And then we talk about health factors. Health factors is looking at things such as tobacco use, diet and exercise, alcohol use, sexual activity. Also, clinical care, access to care, quality of care, education, employment, income, family, and social support, and community safety. And why I'm flying over this area of social and economic factors, we have to realize something. Social determinants of health is a real thing. When someone feels as though that they're experiencing racism, or they don't have enough education, or they cannot find employment, well, they have this internal meter that constantly is boiling over. And what happens is, over a period of time, that starts to negatively affect their health, their mental health, and their physical health. So if you look at the work that we've been doing, but let me not bypass physical environment here at 10%, environmental quality and built environment. What we simply saying is that over the last 20 years or so, we've been focused on health behaviors. Everyone is, I think we've all seen it from the 80s when James Fonda was out there with a tutu on and her warm-up. And don't laugh, because most of them, my mother was one of them, most of you in the room was doing the same thing. Because during that time, it was the stuff aerobics. I'm a stuff aerobics instructor. Some of you said, yeah, whatever. Okay, when I come to your class, teach you one of your classes, don't look at me funny. Then we talked about clinical care. Well, with the Affordable Care Act, they've been having this conversation about the quality of care and access of care. But after we've been doing all of this work, we've only been focused on 50% of the causes of health outcomes. No one has been focusing on the social and economic factors, which we're saying is 40% contributes to the overall health factors and health outcomes. We've been neglecting that. What about the physical environment? The physical environment, which is about 10%. What's so important about the physical environment? Well, I remember when I was growing up as a kid, my father bought my brother a fish, and he bought me a fish. And he said, because my brother's 4 years older, but if you want to have any turmoil in your house, bring one child something, don't bring the other. And I'm learning that I got a 9-year-old and a 6-year-old. I bring something in for DJ, and Jay, oh my goodness, and the girls, boy, they can be some hell. I'm just going to tell you the truth. She had to complain for the rest of the day. I had to run out to the dollar store and just pick up something, just keep them quiet. But we had these 2 fish, so I had 1 fish. 2 days later, my brother's fish was alive and vibrant. But my fish, for whatever reason, was doing a backflip. And so I had no idea what happened. I said we both had water, he had water, but there were some things that was different about his environment, which his fish lived in. He had food. Those little crumbs that you're supposed to sprinkle across the top of the water? I didn't. I had no idea. I figured the fish is there, he'll find something to eat in the water. I mean, I used to go catfish fishing all the time in Texas, and they said they were bottom dwellers. So I figured he'd find something at the bottom to dwell on. And then I noticed that my brother's tank was a little clearer than mine. I had no idea, so I put some drops in there. And I imagined his pH was a little better as well. So he had created this environment for his fish to survive. But yet I created an environment for my fish not to survive. And I'm wondering why my fish is doing the backstroke. Am I making sense about the environment in which we live in? It's going to make a little bit clearer sense as we go through. Make sure you let me know what the time is. We won't let you get too fired up. So when we talk about health behaviors, we talk about tobacco use, alcohol, physical activity, healthy eating, managing stress, and medication adherence. But now when we're having this other conversation about environment and policy change, what are we speaking of? Smoke-free ordinances in parks and facilities. Complete streets policy. There you go, Charles. Gave you another shot at. We got to make sure that our streets are bikeable and walkable. Say for us, the school policies. What is that? Do children have the opportunity to walk to and from school? We have a school bus. There's some other opportunities for children to get physical activity before school, after school, and during school. What about fresh fruit financing initiatives? What about corner stores that want to expand and be able to carry poultry and fresh fruits and vegetables, but yet they don't have the capacity nor the means to be able to have those foods available? So therefore, those that they're serving is missing out because they don't have the capacity or ability to do so when they want to. We've learned that corner stores want to be able to serve their community. Physical education and physical activity in school. What about school wellness policy? Let me get a show of hands. Do any of you serve on wherever you live at on the school health council? You Sal? Is your name Sal? You're not Sal? You're not Sal. Okay. Sean. What's your name? Joe. Joe, I'm sorry. I met you last week at the Lions of Heaven Generation. I'm getting you mixed up with Sal. My apologies. But the school health council, the school wellness policy is a contract between the community and the school that they're going to create this culture of health and ensure that health and wellness is at the forefront of children's learning. If you want to make sure that the STEM, science, technology, engineering, and math, you want to make sure that that criteria children are learning and you have good student achievement, you got to understand what we're feeding our children and the amount of physical activity and the environment that they're coming from is being managed. I just gave a quick illustration about two fish. Same thing about a plant. Now, if you want to make sure that your plant does not survive over a week, you can send it to my house. Not because of me, because I think I have a great thumb, but my wife has a challenge in keeping plants alive. And it's a similar situation as the fish. One of these plants receive water on a regular basis. One of these plants receive some fertilization. Some of them probably have the soil repotted or whatever it's called. Some of them receive sunlight, but one of these plants haven't received that. And then we expect a child who lives in that environment to go to school, to be well behaved, to be attentive, to be the best possible person that they can be. But yet when they go back home, they're in a toxic environment, not including whatever happened in the family structure. Whether or not they've been raised by a caregiver, by their parent, or what they have to fight through to and from school, or whether they're worried about their next meal. Some children leave school, and their next wholesome meal is until they return back to school if the school district have a breakfast in the classroom or a breakfast after the bell policy. This is just the truth of where our children live, and we want them to be full potential individuals and to make sure that our achievement scores go up so everyone is graduating at a 90% level. This is what we do. We send them right back into an environment. So how do we begin to make some changes to this environment? How do we begin to have this conversation? How do we begin to look at this? How do we make children, families, give them the best opportunity to reach their potential? So quickly, the interplay between environment change, policy, and programming in obesity prevention is this. Childhood obesity prevention is essentially building healthy communities. It's building healthy communities, ensuring that your community has certain amenities. A family that can't afford, may not be able to go to a facility, but they can go to a park and be able to walk around and get some activity. That's what we talk about, building healthy communities. Everyone needs to define what's a healthy community for themselves in each community, and hopefully through the conversation today, we'll be able to do so. Environment change, public policy, and programming. That is a three-headed monster. You gotta have some level of intervention, but you gotta have something that's sustainable. For example, in the city of Trenton, we work with Kaboom. We work with over 40 community partners. We got 350 people to come out to erect a brand new playground. And one of the residents who have been living there for over 65 years said, I have been living, she's been living there 65 years. And she said this is the first time she's ever been able to look outside of her window and find a place for the children to play in 60 years. We shouldn't have that, where a child can go out and just spend energy and socialize on the playground. These things are real. programming, public policy, and environmental change. So what does that mean? Environment, attributes of the neighborhood, community, school, or business, whether it's private or public, built environment. Policy, any written statement, plan, law, regulations, ordinances, solutions, or course of action that describes expectations or goals related to physical activity and healthy eating. Equals policies adopted directly influence the environment, impacting those that live, play, and work in a community. Does that make sense? Hopefully that begins to resonate.
What's really interesting, this is from Robert Wood Johnson about activity breaks. So activity breaks have become a little more popular in schools because of the obesity issues. From Robert Wood Johnson, they did say that providing short physical activity breaks during the school day can, 1, increase physical activity of students, 2, help improve on-task behavior, and 3, improve some measures of health. Okay? So today what we're going to do is sleep for a long period of time, we're going to get up and a little activity break. Now what you're going to do is called true and false, and I'm going to ask you particular questions, 8 questions, and all the questions are based on Darren's presentation.
Oh, boy. All right. I didn't know that was going to happen.
Now we're going to stand up, so let's all stand up.
Hang on, Mike. And by the way, you're all on video.
So here's example number 1. It's the first example. Okay. First example is our lead presenter today was Darren Anderson. True or false?
Do one of those, Mike.
Number 1. Here we go. Based on Darren's presentation, Healthy You, Why Diabetes Prevention, and Live Strong are examples of YMCA healthy living strategic initiatives. True or false? Now you keep going if you want. You got to stop. Number 2, environmental conditions do not impact one's ability to be healthy and make healthy decisions. True or false?
You just said one spot. Not 7.
Number 3, childhood abuse affects education and medical costs. True or false? Number 4, of the initial 5 communities targeted to reverse childhood obesity and epidemic by the Partnership for Healthy Kids, Elizabeth was one of them. True or false?
But we wanted it to be, Mike.
It is
That's favorite right now. It's not priority right now. Thank you very much.
Good question, Michael.
Number 5, there was a slide on the tree, which I like the tree slide a lot. When health inequities are low and community assets are high, the health outcomes are better. True. That was true. Number 6, a lack of supermarkets and playgrounds does not affect improvements in health. True or false? And again, health behaviors do not include managing stress, tobacco use, and alcohol use. True or false? Good.
All right, Mike.
Last one, here we go. One of today's main themes is health equity within the city of Elizabeth. True or false? Good job, everybody.
Well, it's actually just when it's lab camp program, certain schools identified. They work with the food bank when they're giving items to actually take home. They're designated by the food bank. I couldn't tell you off the top of my head how many schools participate.
There's no qualification.
There's qualifications, and it comes as there's an application process, but they're determined by the food bank.
Is that on the weekend or is that daily?
It's every weekend, I think on Fridays.
So it's on Friday, the kids get the backpack. What do they do from Monday to
Is that a question you asked me? I was just how the program is set up.
No, yeah.
But I do think that plays a big role too.
Also at the same time, yes.
Of what level of education attainment, because if you're not educated in the sense you're not aware of kind of like the health issues and what leads to what. So I think that is kind of a barrier, and maybe a responsibility for us to educate.
Explain why junk is not good for you, why this stuff is good, and they were trying to enjoy it and go home and spread the word in their family. That's the link that is often missing is getting it in the house. So, yes, just for who knows.
Okay, so now we're going to talk about recommendations. Okay, well, that's the first one. How do we make improvements in this area? So now we're talking about policy, we're talking about environmental, programmatic, systematic. All right, so there's lots of different ways we can go about it and approach it. So think about Elizabeth now. What would be ways that you think might work in terms of how we make these changes, how we make improvements?
At Jefferson Park Ministries, they really picked it. They,
Yeah, we
made
moved
it.
from that side.
I know, that's the current barrier. The barriers
Right.
moved away. We need some continuity. So let's talk about barriers now. You know, what is holding us back what's holding us?
I'm sorry, not being a good listener. You want 2 or 3 overall?
2 to 3 priorities from each group, from your group, that your group felt like stood out the most. So if you found yourself talking about one topic more than the other.
That changes our approach.
You want to expand.
Okay. Well, I think overall, we felt like...
You need a microphone? You need a mic, person?
Can people hear me? I'll use the mic if we have one. If not, you can hear me? Can you hear me? So overall, we felt like the City of Elizabeth had numerous resources that were available to residents. We felt like one of the challenges... Is that better? Yeah. We felt like one of the challenges is around getting residents to actually take part in the resources, that many times we put a lot of effort as community organizations and groups into providing services, but we haven't exactly figured out what the marketing strategies are and how to get people motivated around physical activity. And so some of the, I think, really unique recommendations that were made was coming up with a Healthy City app for your phone, the Passport to Health, getting people who are already somewhat interested in healthy living to get incentives if they go to the farmers markets, if they come to the gym, that they get their passport stamped at each one of those places, and then there are incentives that they earn at the end. We talked about marketing strategies like billboards and really investing in putting up billboards that talk about programming and healthy living. Going back to the old-fashioned door-to-door, where it's more personable and actually having a conversation with someone about becoming active. We also talked about making the city's recreation centers healthy hubs, so it being more than just a recreation center where somebody can go and play basketball, but you can kind of go there for nutrition information, other physical activity, but really making it a healthy hub.
Just as we talk about that.
The other thing we talked about that we thought was important was finding ways to get community members to be stakeholders, to be engaged in buying. We talked about having community forums, we talked about recruiting community volunteers, as opposed to it just being the people whose career it is to try and create healthy living environments, getting people in the communities engaged in that cause. We thought that that was also a critical piece.
Okay.
Just a point of clarification, we kind of identified what community health is. Joint mindset, willingness to eat healthy, reduce chronic disease, increase physical
physical activity and engage our community in these practices. So that was our definition of community health. Okay? And we talked about a lot of different things, but I'm just going to stick to the priorities that we kind of settled on. And one of them is educating children and families about healthy food, fitness, and why it is important. And how we hope to kind of gain the mindset around it is to use our institutions such as schools and churches, our neighborhood health centers, pediatrician offices, and how to get information out on good nutrition, on why it's important to eat, on how we can be fit, and it doesn't take many hours a day. You could walk 15 minutes at a break, those kinds of things. And also, we talked about the importance of building metrics to measure its effectiveness of whatever it is that we put together.
Quite a few pages, so we're just going to go right to the priorities right away. If I forgot anything, guys, please step in. Because we have
Right,
really-
like you got a number of pages.
There was a lot of really good discussion. We probably could have went another 30 minutes to an hour, really. For the highest priority, we had 3. Actually, our number 3 became number 1. We thought the first priority, more funding for overall school wellness. Number two, and 2 and 3 are not necessarily in this order, but the second would be an overall healthy living strategy and education with appropriate marketing. So focus on for the children's, youth, parents, and staff. So overall living for everybody, for the staff, for parents, parental involvement, etc. And then the final one, starting at a younger age. I think the wording was instead of going from the top down, from the bottom up. So starting younger and have them learn at a younger age, maybe they can take that home as well, as opposed to starting adults and coming down. Let's go the other way, bottom up. 2 things that Mr. Dunn said I thought were really cool. He said you got to make it a program, not an event, which I thought was really neat wording. This way, not a short-term thing, but long-term sustainability. And he was joking. He said, him and Sam were saying, kids don't have workout clothes anymore, which is
Play clothes.
They don't play clothes anymore either. So they're in the same attire all day. When you go home, they're in the same attire when they play their video games and stuff. That's a nice little wording, I thought. So, anything else? Did I miss anything, guys?
Marketing.
Oh, marketing. Yeah, the marketing will be tied in with overall living with appropriate marketing for everybody.
Okay, last but not least, Karen and Jonathan on access to healthy food.
You have to eat. And I would just want to take this opportunity to thank the Y for hosting this wonderful program today and for the members of Shaking Elizabeth crew. And all of our interests. We're actually trying to live what we do. So the lunch you're going to be getting today is a farm-to-table lunch from Persino. It'll be served at the appropriate time. I'm sure you'll let us know when that happens. But back to the task, our access to healthy foods. If you don't mind, just to go through the 4 questions and then give you our 3 priorities. What assets does Elizabeth have currently to address the issue? Well, we've got supermarkets, we've got food stores, we've got bodegas. They can be better. We've got farmers markets, we've got community gardens. What are our challenges? Well, affordability is certainly a challenge. There needs to be more education regarding what healthy foods are, where to get them. In terms of, our recommendations and improvements, that would be to hold more meetings, to definitely get the community involved in what the Shaking Elizabeth concept is all about in the program. And our assets would be to have more community gardens, more affordable foods, more programs, and our priorities are 1, 2, 3 top priorities are number 1, get the message out about what Shaking Elizabeth is, what it's doing, what it can do to improve the access to healthy foods. Number 2, develop programs to engage the community, such as cooking programs, more community gardens, garden workshops, programs with the schools. And number 3, which is affordability.
Affordability of foods. Competition.
I'll let Karen finish this up.
Competition of supermarkets, farmers markets, anyone selling foods to bring the costs down. Because that's one of the biggest issues that people have. They can't afford the fresh fruits and vegetables. Somebody just said $3 for a tomato. That's a lot of money. I can make a whole meal for $3. So we need to look at the expansion of what's here and make it affordable, and we need to get education out. Education kept coming up as part of the issue here. So getting, education through community, schools, the city, and then connection of whatever activities are going on. We need to be able to make sure that people know what's happening. The other recommendation really was to get out to all the neighborhoods with information. And I think Krishna brought that up too from the first group, that communication is really critical. So people know what's going on, and then they'll participate.
So the community health needs assessment, basically it's a global view of health within a segmented geographic area. So in 2012, we partnered with Robert Wood Johnson Huawei and Overlook Medical Center and took a global view of Union County. And this view was a systemic approach. And the systemic approach looked at both qualitative and quantitative metrics. So meaning there were interviews with key leaders in the community. There were interviews with residents of the community. Data was pulled from different sources. Phone surveys were done to speak to different community members. And that data was then compiled. And that compilation came out in late 2013. The Community Health Needs Assessment is probably about a 50-page report. And then there's probably another 10 or 15-page implementation plan that I invite you to look at. And it's found on the Trinitas website. And if you go to trinitashospital.org, there's a area where you can click on it and download and read the Community Health Needs Assessment. So there were 5 priorities identified for Union County. Obesity with a focus on prevention of chronic diseases and metabolic syndrome, mental health and substance abuse, improved cancer screening and awareness, access to care for uninsured and underinsured, and then Hispanic Latino health disparities. And I'm coming in and I know that I'm the barrier between you and your special prizes and your food today. And this is a lot of the things that we've heard before, but I think it's important that we drive back down and look and see that these are common themes that are popping up. And they're popping up in Elizabeth, and they're popping up in Union County, and they're popping out across the country. So we're not in this alone. This isn't a small mission, and it's something that's happening not only on a national level, but on a global level. So we identified these 5 goals, and then what the hospitals did was they kind of split apart, and they split apart for a specific reason. Each hospital takes care of a different community, and it didn't really make sense to stick together. Overlook takes care of a lot of Eastern Union County, Trinitas has a lot of Western Union County, and so what happened was each hospital leadership team went back and met with the executive team and said, all right, how are we going to address the findings in the community health needs assessment? So at Trinitas, we decided to focus on 3 priorities. And the first was obesity and metabolic disorders. The second was cancer screening. And the third was mental health issues. And we say those 3 things, but if you look at the healthcare disparity, concerns and the access to care concerns, it's all interwoven. There's no separation. It's all part of the same problem. And so even though we're saying we're going to focus on these three areas, we kind of needed bullet points to come down and say, all right, how are we going to drive down and how are we going to really drive the metrics to make healthy changes and improve the quality of life for people? So those priorities went up through the governing body, so the board of directors of Trinitas reviewed them, approved them, and now we had to come across the implementation plan. So how are we going to do that? Well, we created a community advisory committee, and it works hand in hand. It's very similar to what Groundworks Elizabeth, working with Shaping Elizabeth, Shaping Elizabeth. It works kind of parallel to that. And so the community advisory committee consists of hospital leadership, Krishna in Health and Human Services, so government, local businesses, local nonprofit organizations, and so what we wanted to do is we wanted to create a coalition of different stakeholders who all had similar goals, and that's really the key to this, is that we have varied organizations, and at the end of the day, all these organizations want the same thing. If you think about it from a business perspective, healthier communities mean healthier workers, which means lower costs for businesses, which means more available people to go into the workforce. And that drives the cost of labor down for businesses. So businesses have a key stake in Healthy Elizabeth. The hospitals, healthier patients, better educated patients, are better patients for us. They come back, they want to get preventative care, they want to take care of themselves. They get access to insurance, and those are issues that come across very very often in our conversations. Faith-based and community-based organizations. Faith-based and community. What's community? I mean, let's bring it back. And community is really just groups of people together, and you can segment it geographically and say Elizabeth is a community. You can say Bayway is a community. You can say the Presbyterian Church is a community. You can say Trinitas is a community. Community is just people coming together. So at the end of the day, we have to take care of each other, and that's what we're bringing back. So, of the goals, mental health and substance abuse. This is the 800-pound gorilla in the room. Everybody knows there's an issue. We don't want to really admit it. And why? There's a long history of stigma from mental health. And if you look at utilization in healthcare, two of the biggest drivers, one is substance abuse, which is under-recognized as a key goal for healthy living, and the second is depression. So especially depression in chronically ill people. One of the areas I oversee is our dialysis center, and so we have over 215 patients that come 3 times a week for 3.5 hours, plus their transportation, give or take. So that's 5 or 6 hours, 3 times a week. So we're looking at pretty much a part-time job to take care of their health. And what we found was 50% of those patients were depressed. And what we found was those patients that were depressed had poor outcomes. They didn't live as long. They weren't compliant with their medication. They weren't compliant with going to treatment. So what makes us think that somebody with a chronic disease of diabetes and depression, they're not going through the same thing? They are. That's what we need to work at. And we need to identify, one, it's okay, people are depressed, it's okay. We need to say, wipe out that stigma, bring patients in, and hook them up to the resources that they need to be. The second is cancer. And cancer is something that, if you're looking and you think about the way cancer was addressed 20 years ago, and the way that cancer is addressed now, it's like night and day. 20 years ago, it was a death sentence. Today, it's not. There are focused treatments. The issue that we need to come into is, how do we get people, one, into to know that they're at risk, and that they have the ability to, one, get medical care, get early prevention, and get early screenings so that they can get early treatment. And then finally, obesity. And I'm going to kind of move quickly through this because we talked about it all morning. Obesity and chronic medical conditions. So from a hospital standpoint, this is our diabetics. And our diabetics and hypertensive patients, right? Obesity drives diabetes. Obesity drives hypertension, which drives cancer, which drives heart disease, which drives kidney disease. It's all causal relationships. And when you pull everything back, the real medicine that we need isn't coming out of a drugstore. It's coming out of our pantries, our grocery stores, and our exercise regimes. So how are we addressing these issues? First, cancer. So Trinitas has a robust cancer center and a cancer program. We've increased the amount of screenings that we do, and then we've also increased the amount of education sessions that we do. The more that we educate, the more that we screen, the more that we'll capture, and we'll capture early and get patients into the treatment that they need, and they have better outcomes. The second is mental health and substance abuse. So we're going to be the first hospital in the state to do 100% screening for substance abuse and depression for every inpatient that comes through Trinitas. And that's not a small feat, that's a huge feat. We're looking at over 12,000 patients a year. So if you figure that the city of Elizabeth has a population of roughly 123,000 people, 10% of the city of Elizabeth is going to be screened for mental health issues. But it's not just enough to screen. We also have to connect to the care, because we can tell somebody you need to get help, but unless they get help, the problem still exists. We can't put our head in the sand. So what we did was we made it easier to access mental health, and I think that's a key role as we go through the rest of the thought process today, and then as you take this home. And finally, there's obesity, and I keep saying this over and over again. When we looked at obesity, it was like we were trapped in the middle of the ocean, and we're on a life raft, and there's nobody out there. And so we don't know where to start. It's everywhere. Chronic diseases is everywhere. Where do you begin? And Mike, I always say this at almost every meeting, and he laughs at me. You can't boil the ocean, so you have to start somewhere. And you can boil a pot of water, so you have to start and segment where you're going to begin. I started my career as a paramedic, and this was many years ago, and it was I still work as a paramedic, and taking care of people in their homes and taking care of people in their communities is a very unique and special experience. So I started in New York City, and I worked in Washington Heights and Harlem, and at the time it was before Disney came to New York City. So there was high levels of crime, and coming in, I started to take care of patients, and I couldn't figure out why I was taking care of these kids in their bathrooms. And then all of a sudden I worked nights, and all of a sudden it clicked in. Because the kids had to sleep in their bathtubs, so the bullets wouldn't hit them in their beds. So at that point, you just knew there's a social issue that drives down health. So what's the back end of this? The back end is that kid now, I can't sleep in the bathtub. That kid's not going to be able to be well rested. The kid's not going to be well rested. They're going to have to go to school the next day, and they're not going to have a good meal. And then from that bad meal, they're not going to be able to focus in school. So if they're not able to focus in school, what are their grades going to be? So what choices? So all of these basic needs, they all kind of fall back onto not these. You hear a lot of wording now in healthcare about genetics and there's lasers and there's nuclear medicine tests, and it all comes back to basics, and it all comes back to what are we as humans, what's our basic need, what's the healthy approach to do this, and how do we prevent things from happening? And we're working from one end backwards, and I think what the direction needs to shift is working from the back end forward. And that's something that we, I want you to think about as you go home today. So that geographic segmentation is important. You need to either segment geographically, segment by faith-based organization, segment by community-based organization. You can't take on everything all at once. And that's something that if you have small successes in one place, you can roll them over and create bigger successes along the way. So I really want to stress that point. So when we looked at obesity and chronic diseases, we looked at the current community infrastructure. So we said, all right, we can't tackle all of Elizabeth. We have community partners, we have a great team. What we can do is look at one neighborhood in the city of Elizabeth. And there was no scientific method to it. We kind of threw a dart at the map and said, all right, we're going to look at Bayway. And then we looked at Bayway and said, what's the current community infrastructure in Bayway? And what we found was that Prevention Links has a family success center sitting in the middle of Ravlac Manor. And they're a great partner. And so, you know, in conjunction with the Gateway Y, in conjunction with the City of Elizabeth, we started to work with the Family Success Center. What we had was all these resources, right? And we didn't have a population that was easily accessible. What the Family Success Center had was a population, and they needed connection to the resources. So it's less about creating new ideas and more about linking the areas of need to the resources. So we wanted to partner with people with similar goals, and we needed to partner with the right people. And I can't stress this enough as you look for partners. I'm going to give a bunch of analogies about the city of New York because I have a affinity for it, and then I'm interested in the history. So during the Great Depression and World War II, the mayor of the city of New York was Fiorello LaGuardia. He was 5 feet tall. He's known as the Little Flower, and he had a great ability to connect with people. And that's something that's special. And that communicative ability is so key with connecting with someone. I can stand up here and tell you how to eat, but if you don't know my name and we can't sit down face to face, it's not going to click for you. You're not going to want to do it. You want to have to do it. And so what Mayor LaGuardia was able to do was connect with people on that personal level. And he found out that you can't connect with everybody, and you have to find the right people to connect with to get things done. So one of the lines that I love that he said was, he said, every time you can do something really good, the nice people come along and screw it all up. So who are these nice people? They're easy to find and come in with some scars on their face and some dirt under their fingernails and want to work, because it takes work. And it's not we're going to come in here and swoop down and save the day. It's not going to work. You have to build partnerships, and it's going to take time, and you have to build trust. And that's something that I think that we need to think about moving forward. Who do we trust? How can we build that trust? And to Darren's point, how do we erase 20 years of negative interactions? I think that was such an important piece of rebuilding relationships and focusing on what's important. And what's important is to make Elizabeth healthy. I'm going to talk to you quickly just about this is Plato's Cave. And I know I can see half of you are pulling back from me right now because you're like, what is this guy talking about? It's a 25-year-old, 100-year-old Greek philosopher. There's nothing to do with what we're talking about. So the allegory of Plato's Cave, there was a group of people that were prisoners. And they were prisoners from the time that they were babies. And those prisoners were chained to a wall, and they looked at a blank wall in front of them. And this is before our movies and TV. So what the masters of these prisoners did was they took a fire and then took images and put the images on the wall in front of them. So they created shadows, and it was almost like a shadow puppet show. And so these children grew up to be adults, and all these children knew what was in that cave, and then all they knew were the shadows in that cave. Until one day they came out, and when they came out, they saw sunlight for the first time. When they saw sunlight for the first time, their eyes hurt. And it hurt, and it drove them back into the cave, because the cave was safe, and the cave is what they knew. A couple people pushed through, though, and they went into the sunlight. And at that point, they became enlightened and they saw the rest of the world. Think about Arcade Now. Arcade Now is that since I was a kid, every commercial that's been on TV has been about Frosted Flakes, Doritos, right? What's McDonald's slogan? I bet you everybody knows McDonald's slogan, right? Everybody knows that, you know, will a kid be able to pick out a baseball player now or Ronald McDonald? I guarantee you every kid's going to know who Ronald McDonald is. So think about that. We're not just trying to address the needs of a community. We have a social aspect around this, and we have, and even think about it from a neighborhood perspective. You know what's in your neighborhood. If you have a difficult time getting out to a grocery store that's even a mile away from your home, that's your key. Those are your shadows. If you don't see fresh fruits being sold, you're not gonna, you know, move that direction. You know, think about it, you know, as we move on. Maslow's hierarchy of needs. This is another piece that I want you to think about. And most of us in this room, probably around, there's probably a couple that have found self-actualization. There's a couple that are, most of us are probably within the self-esteem and the love and belongingness. But think about now what we're talking about. And we touched on this earlier. Safety, right? Safety and security. If you're not safe coming out of your house and the park's not safe that you're going to go to, are you going to go to that park? I'm not. It's for us to create the infrastructures to create the safety. And everybody has a choice. And then the physiological needs. So if there's a physiological need, if there's a limited budget and groceries are too expensive, and I love what the group over here said about competition and bringing costs down. If groceries are too expensive and you have to feed a family of 4 and you have $25 in your pocket, are you going to spend $3 on tomatoes or are you going to spend $3 on 3 packages of pasta? You know, that's the truth of the matter. So let's think about that infrastructure pieces. So I wish this was came out a little bit clearer, but this is the city of Elizabeth, and this is the Maravalac homes right here in Maravalac Manor and the Family Success Center. Botano Park is sitting right here. The red X is right across is Trinitas, and this is the closest full-service supermarket. It's 1.2 miles away. So what we started to talk about in the community advisory committees, how are we going to start to address these issues? So we did what we talked about actually here today. We went and talked to the residents of Maravalac Manor, and it was clear to what the needs were. And if you opened up a public health textbook, you could have read the textbook. And they didn't read the textbook, and they knew what was wrong. And what was wrong was the park's not safe. I said, do you go to the park? No, I don't go to the park. The park's not safe. How can I go to the park? Well, where do you go for food? Well, you know, it's too far for me to get, you know, I don't have a car. If the bus is expensive, it's too far for me to get to the... So right there we have 2 issues, and 2 baseline issues. One is that we're saying, go out and recreate. You can't recreate, it's not safe. You know, eat healthy. How am I going to eat healthy? I can't get to healthy food, it's too expensive. So there are barriers there. So we identified 2 barriers. And the third piece is education. And I think that there's a misconception about education. And in healthcare, we present everything to patients at a 6th grade reading level because that's what the majority of the country reads at. And one of my favorite people in the world is one of a nephrologist that I worked with, and he took care of patients in Ecuador. And it was an illiterate population in Ecuador, and they needed kidney care. And what there was, they overcame this barrier because the lack of education doesn't equate to intelligence. People understand. You have to explain it and find out the right barrier, the right way to explain it. And there are cultural ways to do it. And I'm not saying that it's easy, but it's possible. And it's not only possible, people absorb like sponges. If you can remember what McDonald's, you know, that Frosted Flakes are great, you know, you can remember the next level of this. So, you know, moving past this, there are educational pieces that we can do and link people into the important parts of healthcare delivery. Understanding the healthcare system. I've been in the healthcare system 20 years, give or take, and I don't understand everything in the healthcare system, especially now. There are so many nuances and different routes, and that's why there are patient navigators now, to help people get through this crazy mess between insurance and primary care and specialty care and secondary insurance. And at the end of the day, you said, I'm just going to go to the emergency room. And so we looked at the emergency room visits from Mariah Black Manor. And Mariah Black Manor has about 450 housing units, a little over 1,000, probably 1,040 residents. And the residents of Mariah Black came to Trinity Hospital's ER 895 times last year. 895 times. So how do we teach people, one, there are ways to go about it that are healthier for you, healthier for your family, and how do we create an ease of entry into the healthcare system? And it's access to care. I think that, as we see more people be insured, I think that's a great thing. But I think that there's also education pieces that go along with the insurance. So, providing the tools to allow for healthy choices. Because at the end of the day, we can provide all these tools, but if somebody doesn't want to change, they're not going to change. That's the bottom line. And when we look at different programs in population health, I look at things in thirds. And so we build business models around everything that we do. And the idea is that 1/3 of the population isn't going to want to do anything with this. They're not going to change, they're not interested, they don't want to do anything. The second third of the population, they're interested, they know they have to change, they know it's the right thing to do, but they don't get it done, and they drop off along the way. And so there's not a significant change with that. 1/3 of the population is where they do what they need to do, they see the significant change, and they have positive outcomes with this. And I want to stress this point. With all of these things that we talked about, this isn't a sprint, it's a marathon. Okay, smoking wasn't addressed in the manner that it was in 1 year, or 5 years, or 10 years, it was 4 years. It's multi-generational. It's kids getting on top of their parents saying, Dad, I went to school today, and they said I shouldn't eat this anymore. That's what it comes down to. So it's really driving through the point of, we're in this for the long haul, and there's not a silver bullet, okay? It's taking off slices after slices until we get to the point where we have a healthier community and a safer community. The shift to focus on prevention, and that's something I talked about already, and it's prevention from the sense of dealing with issues as they come up, especially with mental health, and it's prevention as to knowing what you need to do, knowing who you need to talk to, and actually getting through and doing it. Screenings for targeted diseases, cancer, heart disease, kidney disease. There's 20 million Americans with kidney disease. There's 800 and almost 900 patients on dialysis in Union County. And there's probably another 20,000, 30,000 people in Union County that don't know that they're in some form of kidney disease. So screenings, understanding that it's important. How many people know why the kidneys are important here? Build the waste products out. Do you know that they also control your blood pressure? Hypertension, right? Hypertension, diabetes, right? It all links together. So, get them while they're young. Like I mentioned before, schools are so important. Schools, parents especially, 55% of the residents of Elizabeth were born outside of the country, right? And I know because my wife was born outside of the country. As a child, she taught her parents just as much as her parents taught her. And it's the same concept here. Okay, if we teach the kids, they'll go back and teach the parents, and the parents will come back and teach the kids. So it's creating that